Whether it's how you look or how you see, your eyes are vitally important. We're going to talk about thyroid eye disease and an innovative procedure that can treat it. Many people have heard of Graves' disease, a thyroid condition which could be characterized by rapid heartbeat, irritability, fatigue, fluctuations in weight, or hair loss. But did you know that Graves' disease can also show up in your eyes? It can be mild as dry eyes or as severe as vision loss. In some cases, fatty tissue builds up behind the eye and creates so much pressure that the eye is literally pushed forward in the socket. The medical term for it is proptosis. The not-so-medical term is bulging eyes. For the patient, it looks bad, it feels worse, and it could even threaten eyesight. But thanks to an advanced surgical procedure being done by physicians at Baylor, Scott & White Health, this condition can be treated. The swollen tissue cannot be made smaller, but the eye socket can be made larger. The outside wall of the eye socket is removed, and then a portion of the bony rim is put back in with small screws, which the patient cannot feel. The bone grafts attached to the bony rim allow the bone to advance and fuse back together. Then, using computerized navigation, the doctor is able to precisely pinpoint the portion of the inside wall of the eye socket that needs to be removed. The swollen tissue is then able to prolapse into the medial part of the nose, therefore resulting in what is called a balanced orbital decompression. With the eye socket space increased, the eyeball now has more room and will fall back into the head, thus relieving the pressure and allowing the blood flow back out of the eye. Let's learn a little more about the procedure.
So the unique approach that we have here at Baylor is we have an approach with an orbital surgeon working at the same time as a skull-based ear, nose, and throat physician. So to achieve a balanced decompression, which is a safer, more elegant procedure, the orbital surgeon, myself, does the orbital portion of the decompression, essentially removes part of the bone in the eye socket. And instead of making a separate incision to remove the inside bone of the eye socket, Dr. Botke, the ear, nose, and throat skull-based specialist, is able to go up the nose with no visible incision and remove that bone. And because he's able to visualize things so well with the new technology that we have, he can do a more adequate decompression than I can do alone through the eye socket. So we're more effective, and it's safer to do a combined approach than not.
Oculoplastic surgeons like Dr. Gilliland have expertise working in the outer part of the eye socket and the under part of it. Skull-based surgeons and ENT surgeons like myself have an expertise in working along the inner side. If you just address one of these components, then there'll be an unbalanced situation. If you do more on the outside than you do on the inside, what ends up happening is that the eyeball itself lists outward. If you do the opposite and you do more on the inside than on the outside, then the eyeball will list inwards. And when that happens, then you have a higher incidence of people being cross-eyed after this type of surgery, which is not what we want. Our rate of having double vision is very low because we're able to do equivalent amounts on both sides, and that lets the eyeball sit back in the dimensions that we want without it having listing inwards or outwards.
So typically, patients will notice when the swelling is gone within the first 10 to 14 days that their vision it clears up. We've had patients that couldn't see your hand in front of their face, that were completely blind. We did the procedure and they came in for their first visit post-op and read 20/20 vision. At
Baylor University Medical Center, we do approximately 50 of these surgeries a year. We have very low risk of infection and very little bleeding issues that come after that. And the vast majority of our patients are very happy with not only the way they look, but definitely how they feel and how their vision functions after surgery.
It certainly sounds like patients having a balanced orbital decompression at Baylor, Scott & White Health have the best of both worlds, a functional and aesthetic outcome performed by the skilled hands of our surgeons using advanced technologies. So if you are concerned about how you look or how you see because of a thyroid condition, call Baylor, Scott & White Health to schedule an appointment.